I can have a question for you two, if I can put you guys on the spot as like the law enforcement minded folks you are in the tactical mindset. Why does it take you so long to ask for help?
Down, it's time to focus on myself, and I'm committed fully, adapt and overcome, stay ready, always fit for duty.
Say whatever you want, say how you feel, talk how you want. Pretty much like as honest as possible with how you feel in that moment. But with this topic, it should be great. I love the topic itself. I love when I heard you on, we were doing the same seminar, and to hear about something with people doing this type of like stuff with law enforcement and first responders, I think is awesome. And also I was like super happy that we got in touch and got connected and to be able to kind of talk about it, because I wish that was everywhere. And I know it's only right now in your guys' area, because I don't know of anything on the West Coast. And then now that I'm in Texas, I don't know anything in Texas. So to be able to kind of provide that kind of help and service to first responders on the job, like that's awesome. And the reason why I thought about it too, because it was funny, whenever we were at the webinar, I was just talking with one of my friends. He's a Green Beret, and he's been with the Green Berets for like 10 plus years. And I've always known it, even being in the Marine Corps, a lot of the guys in Special Forces have like on hand nutritionists, on hand physical therapists, on hand everything, personal trainers on the spot, because they're being treated like, like you are given the best help. I understand with our first responders, like, they're not even the SWAT teams, because I was on SWAT, we weren't getting, on hand nutritionists or, physical therapy, something like that. So it's like not even that the people at the top are getting that kind of level of support. So, and when you're dealing with pretty much a tactical team, or even guys as individual tactical people, and they're just getting like, yeah, here, just work overtime, stress yourself out, and forced overtime, and we're just gonna not care about your health whatsoever. Yeah, can I go into pro teams with that?
I was gonna say, it sounds kind of crazy when you say it out loud, right? Like when you actually put them side by side and you're like, wait a second, we're not that different than an athlete or like, an elite level performer. But yeah, to get into it a little bit, it's funny that you say like our area, we do have our program rooted out of the Indianapolis market. We were here first in Indiana, but we do have a clinic open and growing very quickly now in Las Vegas. So we are on the West Coast now. We also have another clinic getting very busy in Little Rock, Arkansas. I mean, across the country, we're getting a lot of attention. The thing that we encounter from what we do, and when we tell people what we do and we tell people how we approach first responder wellness, it honestly just sometimes takes time for them to like really believe that we're able to do these things, because it's so foreign to what they're used to how they're used to being either treated or the access and resources they have towards wellness. Because, typically we know our first responders generally have access to an employee assistance program. Maybe they have access to a wellness unit or some kind of like wellness resources, or they'll kind of like outsource them, but they've never had something like dedicated solely and exclusively to them, with providers who are culturally competent, understand the inner workings of like kind of how you guys tick too, and how you view your work and how you view your bodies. And so it is a really unique thing that we have going on, and we would love to be everywhere and serving everybody. It's just that things take time and we're growing quickly. So hopefully maybe we'll be in Texas someday and you'll hear more about us when we're there. But I want to take a second to introduce Brice too, who's currently my intern, but a police officer first and foremost, and a husband and a dad and all the great things. But really working beside me over the last 4 months or so, been a valuable insight into even just really the brain of law enforcement, how you guys feel about your wellness. The overwhelming majority of what we hear in our program is like, we want to be better. We want our bodies to feel better. We want our minds to feel better. We want these resources. We just don't know how to start or where to start, or how do we get your resources to us? That's a lot where either I come in or my director of operations, our leadership, goes out and travels to a lot of these different agencies all over the country and shares the education that we have of like how our program can work. Our program has been very successful because, like I said, a lot of times we share our model to agency leadership and kind of the brass. And they just are like, no way. There's no way that happens. There's no way people buy in. There's no way that's possible. There's no way you save the city that much money. And it's like, numbers are numbers. I don't know, how to make it more data driven than that. But yeah, it's pretty amazing to kind of just see the reaction of people when we tell them how our program has impacted the places where we've been. Louisville's another one. We just wrapped up our first full operating year as ProTeam Tactical in Louisville with Louisville Metro, PD, and Ed.D. And the sheer amount of positivity that came out of the program. Also, the savings, the cost savings, the time savings, the human capital that goes into having proactive approaches to wellness was pretty remarkable.
No, exactly. And one thing, like you talked about with the numbers, because it kind of popped in my head, and I started thinking about when I was working, is it does make sense to me. I guess I've been like I was telling you, I've been fitness coaching since like 15 plus years now. And so even when I was in law enforcement talking to guys, and they're always trying to find different ways to be better, but they were just completely lost on where to start, which makes a lot of sense because they're hearing so many things about online about, do this, do that. David Goggins said, kill myself in this, run 14 miles. And, and then it's like, do the carnivore diet, do this diet, do that diet, I should train every day. And it's like, with me, obviously doing it so long, it's more just like sustainable, like get there first. Don't just try to jump into the freaking ocean. But the numbers make sense because if you're working on wellness and you're working on bettering your officer, your deputy, they are going to not be as hurt. They're not going to, be going to taking off time and whatnot. Like they're going to be better performers. And I feel like most of the admin these days are just so focused on what is it going to cost, and that's too much. And yeah, let's just throw this out. But then again, the part that got me like that popped in my head was just like, we're willing to spend money on bullshit that's just like, take this training online, watch a couple videos. No one's taking it serious. They're just going to click through it or try to find answers from someone else or online. Click through it. Are they going to send that officer or deputy somewhere? But it's just going to be a mini vacation for them for 2-3 days or 5 days. And is it fun for the officer? Yeah. We're going to go out there, we're going to go drink, we're going to have fun. But was it really necessary for him to go do that, spend hundreds of dollars or $1,000 for those officers to go? No. Would having ProTeam on site be better than that? Most likely, so it's like, that's the stuff I think I would always think about is like, even being the one that's being like, to be able to go to these different things, is it really necessary? Is it really making me better? Well, myself was already better because I already knew where to start with my background. I already knew how to be better at that. But most of the guys are not, I was spending my own money to go to physical therapy when I needed to. I was spending my own money to go get a massage on YouTube. But again, that's just, everyone's going to be a little different. And they don't really know where to start. And I can't coach everyone at work, while I'm still working as well. So I really love that. But can you go into, for listeners to kind of understand, what is ProTeam? What is ProTeam pretty much comprised of? And what is it exactly that you do? Because I already know, but I kind of want to make it very clear so everyone gets excited as I was when I first heard about it, because that was awesome.
Yeah. So ProTeam Tactical Performance is a company that takes the same level of elite care that you would see in professional sports or those big Division I athletics, the sports medicine model of healthcare, and has adopted it and adapted it into the world of first responders. So not only police, but firefighters, EMS, and corrections. And so, when you are watching those big sporting events and you see athletes get injured, there's someone on the field with them in real time assessing their injury. If they need further imaging, it is done within the same hour. And if they need surgery, depending on the severity of an injury, it's happening maybe even the same day. So that model of healthcare has been brought into the fold with first responders. So in our clinics, we're focusing on musculoskeletal orthopedic assessments, treatment, rehab, non-operative, post-operative, you name it, as far as ProTeam Tactical goes. But we also know that our first responders, just like everybody, has an aspect of their recovery that certainly affects their mental and behavioral health. So we have ProTeam Wellness as well, which is our behavioral health clinic. And we are able to really approach their recovery from all ends of the spectrum. So the body recovery, the mental recovery, and give them the same kind of level of care an elite athlete would get playing professional sports.
I love it. So how does it all work? Can you go into, let's say, a department's like, yeah, we're all about this. Let's do it.
So, oh gosh, there's a lot of a lot of meetings that happen, I'll be perfectly honest. So let's say an agency wants us, a lot of agencies fly out to Indianapolis just to see our clinic in real time and our model. Because like I said, when we explain it to people, they kind of don't believe us. So they do a lot of times show up on site to view how our clinic works. Because I'd love to give you a tour, but there's patients out there right now, so I can't, break HIPAA. But they'll fly out, they'll see our clinic. Our clinics, if you've been an athlete yourself before and you've seen those programs that have a lot of money, how they outfit their clinic, how they put even just this all the way to like the signage up, everything is just kind of like very highly professionally done. But we start having conversations with them about who in your city is your workers' compensation provider, who in your city like are the decision makers, how do we get in front of those decision makers? Because a lot of times from the point of interest, let's say, to the actual like first meeting, that can take some time because we have to get in front of big influencers and people that honestly like do care about the bottom line, because a program like ours really just depends on how many people are in your agency. We serve agencies of 1,200, a huge metropolitan agency, all the way down to agencies that might have 40 officers or even volunteer firefighter agencies. So we'll see them all. It's not a one size fits all either. You might not need the whole cavalry of us to come in. You might just need to know you have resources and backup. You might not need a physical whole space clinic where you are. Our whole program is designed around the need of the agency and how we can get them the resources that best serve them, because we're really not interested in selling the program. We genuinely care about the needs of an agency and the officers.
So for anyone that's not getting the full ProTeam Tactical on site with their own like infrastructure right there, how do you work with someone with a department that has like, let's say 50 to 100 officers?
Some of our agencies, if we're not physically like right in their city, travel to us and travel to our locations. So for example, in Indy, our downtown clinic is in the heart of downtown. We have people traveling sometimes 2 hours to get to us. They probably have resources right in their city, but they'd rather travel the 2 hours to come to us because they know the kind of care they're going to get and the type of one-on-one experience they're going to have versus going to some clinic in their city that might not serve exclusively to first responders. So it really, I don't love always saying it depends, but I know our folks will travel quite a bit of distance just to get to us because that's how important it is and that's how tailored we make their care. So travel is definitely one of them. The other, and that's on the tactical side of the house, but on the wellness side of the house, our behavioral health clinicians do telehealth. So those services can be pretty unlimited and reach as far as they need to go.
Now, as far as like the service being offered, is it going to be by each personnel basis? Like we're going to send over 10 or 15 people, or is it like we're going to cover the whole department itself?
No, we usually will get the whole department on board with us at a time. And sometimes like when we're starting out, we might kind of have like a couple test patients. Cause like I said, a lot of people, when we tell them about our program, they really kind of don't believe it. So sometimes they'll like hand select a couple people to be like, well, why don't you go in and you tell us what it's like? Kind of like a guinea pig. And they'll kind of send us a couple people to like test us out. And they'll come back and they're like, dude, you gotta go. Like it's kind of unbelievable, but like I experienced it and I'm sold, and it sells itself after that point. Like good news travels fast. So once we have an agency, though, we have the whole agency. It just kind of depends on how comfortable they are coming to us. Cause, I have these conversations with Brice all the time. We understand and we respect the fact that you guys aren't easily sold on a lot of things. Like you kind of have a hard time understanding like someone else cares about you. Someone else is looking out for you. And we actually do have your best interest in mind.
Exactly. And it's funny because with you guys being in Las Vegas now, I can see a lot of departments, even in Central California, where I was from, could make it out there if they were being serious about this whole thing. Because if we're willing to send guys to do the marathon in Las Vegas, or that, I can't remember what it's called, like a 10K or something like that. Then we can send guys to go get, ProTeam and go actually work on that and get better and whatnot. Because there's so many things that happen in Las Vegas as far as like trainings and big, huge things like that. We could definitely send some guys to go do that because we'll send guys to San Diego for K9 training or just to become K9 officers. So why not just send 5 hours away to go to ProTeam and be better and get better? Brice, did you ever go through the actual like become one of like the patients first before being an intern with Beth?
ProTeam just through research and then through my grad program, kind of tried to sell myself for them to take me on as an intern. I guess I was successful, but kind of to Beth's point, the thing that just really stands out to me is like as first responders, so many people count on us. It's hard for us to open up and accept help, whether that's mental, emotional, or physical. It's hard for us to get to that headspace. And what I love about ProTeam is that, we kind of talked about it just culturally, our behaviors, the way we talk, we get into our safe spaces, at the police department, we have our dark humor. They get all that. And their clinicians understand that, we're in these vulnerable moments and we need an outlet. So they're excellent in their whole total standard of patient care.
Love it. You guys, are you able to give me an example of, let's say someone want to send a guinea pig to go to you guys to go see how this is? And then what would happen the moment that they showed up to ProTeam?
Yeah. So I think that everyone's first appointment, this is really interesting to kind of put myself in those shoes. So this is generally how it goes. There's a couple providers at each site. And so let's say I'm meeting someone for the first time. And I picture it to sort of be like roll call in a way, like there's these conversations going on over here and these people have been here for a while, so they're jaw-jacking in the corner. And so when you walk in as the patient, you're like a little intimidated because you're showing up to physical therapy. It's going to be like really sterile and it's going to be really serious. But you've got like an F-bomb flying in the corner over here. You've got like people laughing over here. They kind of walk in. And I think the coolest thing to see them is to kind of go, oh, this is not like that. This is like, everyone's a little more chill. Typically what happens is the patient, we try to keep ourselves a little buttoned up on appointment 1 just so that we don't scare anybody away. But, we will joke around with the other patients like, hey, it's their first time. Like, don't scare them yet. Like, we can't, be quite ourselves just yet. We're sort of like feeling each other out and figuring it out. But I think a lot of times when you have 3 and 4 first responders on treatment tables together, it feels very familiar. You feel like you're on the street because you might know someone you're sitting next to because you've had a run with them before. Or, it just kind of takes some of the pressure away of it being so of an appointment, like a doctor's appointment. It's not like that. It is very relaxed, but still very professional, very top level care. And I think, even in appointment 1, my goal is to kind of get at least a smile or 2 out of a patient. Because 1, they're not only coming to us with sort of their mental armor on because they like don't know us. And I know you all can be a little standoffish at first, but they're also coming to us kind of vulnerable because they're hurt. So the first thing they're always like, I'm fine, I'm fine, I'm fine. And it's like, you're not fine. You're here because you're hurt. I literally had a patient on his first appointment walk in, look at me. I've never met this man in my life, and goes, I'm staying full duty, just so you know. Don't try to take me off the street. And I was like, hi, my name's Beth. Nice to meet you. Why don't you come sit down on my table so I can take a look and see what's going on and see like how bad your injury is. And just sort of like, be less hyper vigilant while you're here. But it takes a couple appointments for them to even realize like, okay, I don't have to be like the hard ass that I show up to at work every day. Like, they got my back. So that first appointment, we want it to be casual, but we also understand we're kind of doing this dance of like, who are you? Why do you care so much about me? And what's amazing is I've had patients leave before, call their sergeant or lieutenant and be like, they're so nice. Like, why are they so nice? Like, I just left, feeling really taken care of and listened to. I already have a doctor's appointment set up. They called me right away. So I think for a lot of people, like wrapping your head around that first appointment is like, that was awesome. And I hope that's the feedback we always get. And so to put myself in their shoes, that's how I think, at least how I've heard people feel when they leave, is taken care of.
That makes a lot of sense. So their biggest stigma with themselves on the physical side of pain is more like, even on the mental side, is like, I'm going to work regardless. So don't try to say that I'm hurt and I can't work and whatnot. That makes a lot of sense. It's so weird because that's honestly new to me because when you present it with, the professional athletes get this kind of care. Like when I was hearing you tell me, I'm like, I love that messaging. It's awesome. But these guys on the lower level who maybe not heard you, maybe it's just the admin talking to you. They're whatever telephone's going on from there to the officer, like, hey, just go see this ProTeam Tactical. And they're just like, okay, what is it for? Now I'm nervous. Now I'm going to go see a medical professional. And I feel like the messaging kind of gets lost there because now they're thinking they're going to send me here. They know that my lower back hurts. I'm not probably going to be able to work. And then I don't want to be put on leave. So it does make a lot of sense. So the whole point, the whole thing, I feel like, is trying to break that stigma every single time you get that new person in there.
Yeah.
I think it has to do with our identity. So much of our identity is what we do in this profession. And to have that, the fear of that taken away, it's scary. And I think professional athletes go through that too. 1 minute you're the superstar and you're injured, and then your career could be shot. So that's kind of what I relate it to, is just that loss of identity, and we're not ready yet.
That makes a lot of sense. Like you said, like one guy could say he has an Achilles injury and he's out for 6 games. And you're just like, not only is he pissed, all his fantasy guys are pissed. Everyone's mad. Makes a lot of sense. So when someone comes in there, let's say they get because one of the biggest injuries, our biggest pain points that even with myself and I know a lot of other guys feel as well, or guys and girls, is sciatica and like lower back pain. So if they were to come into you guys you guys get your initial assessment, they did all that. What is something you guys would recommend or do in those sessions to kind of work on that pain? So
yeah, we see that a lot. I think the biggest thing that my folks realize is that I know I'm seeing you for this back injury right now. However, your back is actually usually 9 times out of 10 not the problem. It's because you don't have really good hip mobility. It's because you don't have good ankle mobility. It's because you don't even know how to use your posterior chain. Your back is unfortunately just the victim of all these other villainous circumstances. And I can't change your gear. I know you've already in a molly. I know you already transitioned to like a drop holster. You've done all the equipment things that you can move around to get weight off of your back, so to speak. I can't really necessarily get you out of your car and out of your report rating in your car in that super awful position all day long. But if we get your hips moving better, get your ankles moving better, if I can teach you how to even know what a hip hinge is and things that are related around global mobility. After a couple appointments, people are like, I didn't realize how tight my hips were. I didn't realize that I, sit to stand that way. And just changing these little ergonomic things, they're like life-changing, like, pain-free pretty quickly. Because like I said, a lot of times those kind of chronic things or those things that have just been nagging at you for a long time usually isn't the issue. It's just where the issue is landed. And when we start educating our patients at that very first appointment, they're really surprised at how empowering like they can be just for themselves. I know I'm the healthcare provider. I know I'm the one that needs to get you better, but you are responsible for your own wellness and how that extends far beyond this appointment or even in the time seeing me. So here's a tip, here's a tip, here's a tip, here's a tip. And then by the time I'm all done with them, they're like, I've completely kind of changed how I view my own workouts or how I attack my wellness or how I think about even my body. Because people with back pain, for example, I'll say, okay, so do you deadlift? What do you do to lift? They're like, oh, I haven't done that in a long time. That's how I got hurt. I don't want to do that. And I'm like, you need to do that. You need to be able to do these things. It's healthy to deadlift. Don't be afraid of the barbell. We are very movement based in how we train people. We are not going to adopt kinesiophobia to then perpetuate the pain because movement is medicine. Exercise is medicine. Mobility matters and motion is lotion. So let's effing go. We're not going to follow the scared pattern that you've fallen into. And hopefully you feel better leaving here than you did before you even got here because you're not going to be afraid to do it anymore.
Mm-hmm. I love that a lot. So I have a story with that. One of my athletes, because I train some athletes as well, where I went back home, California, trained with them for a day, and they were doing deadlifts, and they finished the set, and I was like, you had a little more, and you're like, why do you stop for? And like, well, because I have a lower back injury. I'm like, I know that, but your lower back injury was from 6 years ago. So why are you stopping on this set? because I mean, most of my coaches mostly online. So now I'm in person. I'm like seeing it in person. I'm like, why are we stopping right now? It was so long ago. Well, because that's how I got hurt. Like, okay, well, you put that kind of level of like insecurity on you to where you don't want to push past that limit because you are scared of getting hurt. You ain't never going to you ain't gonna be able to train hard enough to get the growth that we want. But then two, you're always going to be scared. And then you being scared might even get you hurt again because now you're so scared of the movement itself. So just do the movement like if nothing ever happened, because you are fine right now. It's not the next week. It's not the next month. It's literally 6 years later. So who cares? Just do it. Because it's great for you. Like the whole point of working out and being in the gym or do whatever you're doing is to work out, to cause pressure. The growth is under pressure and stress. It's not under working out at 70%. Like we're not here to do that. You might as well just go for a walk. So we're not here to maintain your growth. Your goal is not to maintain. Your goal is to be better, and to be better has to be under pressure, because muscle is created under pressure and stress. Yeah. So I love that a lot.
And I know Brice and I had talked about that. He's, not to put him on the spot, but had sort of like a nagging thing going on for a while. I'm like, when are you going to get that checked out? He's like, I'm fine. Don't, even though he's around me all day, well, not all day, but even though he's around me a lot, he can't get out of that mentality either of like, I'm fine. Eventually, maybe he'll get it looked at. But, there is a point too, though, where you need to listen to your body. There, like that fear versus injury kind of spectrum. Because to your friend's point, right? Like 6 years ago, physiologically, that's healed. Physiologically, you're actually not, there's no way you're still injured. Maybe you have some chronic like arthritis now from it or something, but like moving through that pattern, because it's actually a pattern you built up in your brain to tell your body to stop because it hurts. It probably doesn't hurt. You're just scared. But on the reverse side of that, to y'all's mentality, I also don't care if you can deadlift 450 pounds. I really don't care. I care that you can deadlift 1.5 times your body weight, maybe. And so maybe that's approaching 400 for some. But we know that in our performance-based world, 75% of your body weight is a healthy amount to be able to deadlift. Your body weight is a healthy amount to deadlift. So it's either like my patients are way over here and kind of like stupid strong and doing stupid shit that they don't need to do, or my patients are like way over here not doing enough. And so trying to find the middle with them is where I want to land.
No, exactly. And like in the back to that example, we ended up putting more weight, did the set flawlessly. And I was like, did it hurt? No, exactly. And all these years you've been training, all the whole time you've been with me, and I wasn't seeing it really in person. Now you know. Stop being scared of that. I don't know if you remember my story or not with my pain in
your neck,
kind of like my upper back.
Yeah.
Yeah, so it was because I was so happy about this, because it was because of a physical therapist who caught it. Because just like how Brice, with the whole issue with Brice, like you were saying, with not wanting to go get help, it went 2 years for me of going to see help. So 2 years of a small pain in my upper trap and then shoulder pain. I was like trying to just deal with it myself, trying to figure out, change up movements, some exercises, change up all the workouts and whatnot for 2 years. And I was like, and the pain just got worse and worse, to going from like 32 pull-ups to 1 pull-up, but just doing 1 pull-up hurt extremely bad. And I finally went to the doctor, and he was like, okay, your shoulder, you have a torn labrum or whatever. But he's like, it seems pretty old, and that was from the Marine Corps. But he's like, maybe it's just that, maybe it's just flared up. And I was like, I don't know. Sent me physical therapy, and my physical therapist was like, you have a neck issue. It's like, yeah, you have this shoulder stuff, but that's not what it is. You've been dealing with that. You kind of already do your thing around that. You have a neck issue. He's like, I'm going to go send a recommendation to get an MRI for your neck. And then I went to get MRI from the doctor. And then, 3 bulging discs in my neck in the C357. And so it's so cool how a guy just with his hands like, nah, this is the issue, doing his little testing. So I was like, it's funny because I never really believed in like going to these things, like going out of my way, not to go seek help and not to go to an appointment. And then now I finally gave into it, and it was so cool to kind of get that help and be better, because now I'm back to doing pull-ups like no problem. I'm back to deadlifting again, because I couldn't deadlift nothing. I couldn't pick up my own kid. He was like 1 at the time, and it hurt so bad. And now I could put 3 plates on the deadlift again, no problem, but reps. So I was like so happy, like to be back where I am now and be in so much pain. Then it's so crazy. But again, it all comes from just seeking help, because those 2 years trying to do it on my own, it wasn't getting nowhere, So
I can have a question for you too, if I can put you guys on the spot as like the law enforcement minded folks you are in the tactical mindset. Why does it take you so long to ask for help?
For me, it's, well, there could really be something wrong, and then I would be out, and it's that loss of identity thing. That's just kind of a little bit of it for me.
My thing is more like that's a part of it. but it's a lot of I have to go out of my day now to go to this appointment. And if I am hurt, I'm gonna have to stop doing what I love to do. But it's mostly putting on something that I don't even know how the process works. It's just me thinking how the process is gonna be. The physical therapist or doctor's gonna tell me don't work out anymore. That's not gonna happen because I love to work out. So, and he's gonna tell me to do this and tell me to do that. I'm not taking medication because I hate medication. Like I'm not one to. I took Norco once, or was one of those like Norco when I got my teeth taken out in the Marine Corps, and I remember taking one pill because they give you. I don't know why they prescribed that for, but like years ago they give you like those medications for when they take your teeth out, and I got sick. So I was like, I'm never again taking shit like this again. And so I only stick with ibuprofen. That's it. And I don't want to do surgery. That's the last resort. I would never, even if it's last for all, I don't think I ever do it. That's the stuff I just don't want to do. I don't want to stop doing what I love, which is being active every day, being able to work out, because that's my one passion since I was 14. So if you take this away from me, that's my identity now. What do I do now? Yeah, being a cop is great. I love being a cop. I love being SWAT. But if you take away me being able to be in the gym or working out outside or pulling something, dragging something, slamming something, I'm going to feel less than, because what do I have now? Like going to work is great, but I love doing this after work or before work. It was the one thing since I was younger too that kept me sane. It's like my own little mental therapy, take that away. I got no more therapy now.
Yeah.
So.
Yeah, and my 2 cents about, seeing someone, I get the apprehensiveness or like fear in seeing somebody because the what ifs that you sort of mentioned there. If I can kind of just impart any healthcare mindedness to the conversation, is like, if you do see a provider and they are, a specialist in orthopedics, and they use air quotes because like a lot of people like specialist or whatever word kind of scares some people, or they're like, not a generalist. But anyway, and they specialize in orthopedics, and their advice to you is to stop doing a certain exercise or to like stop being physically active, leave the appointment. Because that's not healthy. Like there's literally a whole nationwide initiative called Exercise is Medicine. So while you might have to modify some things for a little while until we get to the root of the issue, you should never stop doing physical activity. You should never stop doing things that kind of like keep your mind right too. A provider, this is where our healthcare systems kind of failed every patient, is we forget the human in front of us and their needs, and try to like apply one thing that to a big population. But if my patient's telling me like the only thing that's keeping me sane is BJJ, I'm going to say, okay, then go, but like don't go full tilt, and avoid, partner up with somebody, when you tap out, they're going to listen to you because your knee's not great right now. Like taking things away that sort of keep you in the right mindset, that just sort of fill your cup in a different way. Like you've got to keep something that helps you feel good about your everyday habits and your everyday like desires. When you start just taking those things away, it's really kind of it's a quick downhill slope for that person in their overall recovery.
Exactly. And that's why I love that I had met Dr. Andy Hill in Clovis, California, because meeting him changed my perspective to like how you think now. Like I'm all about this stuff. I love it. But it wasn't until meeting him to be able to see like, no, I'm not telling you to not work out. And we worked out together. He's like, all right, let's go to the gym now. Because he has like a little gym in his little area. And he was putting me through exercises. I was like, this is awesome. But he was teaching me different movements that I never thought I could use to make this, like, I was just feeling better. So when I would leave him, I'm like, I feel better each time. And we're still working out with weights. And then he just tell me like, here's some recommendations for when your workouts that you do it on your own, to do this, do that. Don't go so hard on this, but then, still keep doing what you're doing based off how you feel. But each week I'll just get more intense on my own stuff. But it was because we were getting better with what we're doing in the gym with him. And then plus like the different stretches, whatnot. I never knew how, I don't know. I call him magic hands because the stuff that he would do was insane. So
I don't know if it's funny that I've never asked Brice this question, but Brice, what was your answer to like, did you answer the question, why do you guys wait so long?
Yeah, I think it's just, like you said, there could be something wrong that would actually take me out of doing just piggyback on what Gilbert said. To take me out of something that I enjoy, that gives me an outlet, that makes me who I am. Very similar story. I started hitting the weights at 15 and never looked back. So I often actually think about that. I'm getting be in my mid 40s now, but I often think about like how many years can I do this? How long can I work out like this? In my 70s, can I still push heavy weight around in my 70s? I hope so. But, I just kind of think about like down the road, just doing something that I love. How does that end story happen?
I found what's really interesting too, being on my side of it, because I've never been a police officer. My dad was a police officer. I have a lot of military in my family. I think that kind of helps my general understanding of how you guys tick quite a bit. But it's really interesting because when you get into like the different units, they all kind of have their own personality too. And you being former SWAT guys, my example of like, I'm staying full duty, don't take me off work, I won't come back if you do. He was a SWAT officer.
Yeah, there's that aspect too, that people are relying on you. There's that aspect too, that teammates, people, the community, in my position, several folks within the department, they're relying on me to be there. So to have an injury to take me out of that, it's just easy like you're letting people down.
Exactly. And the one thing I loved about SWAT was like when I was doing patrol, stuff like that, or even detectives, I mean, it's okay. Like the job's a job and I enjoy it. But doing SWAT was the one thing where I enjoyed going to do work. Like it's the funnest work.
Yeah.
Like you enjoy all that stuff. Well, I guess with my background. And so going there was never like, you call me out. It's like, awesome. Like I've been waiting for this call forever, So it's like you get excited. Getting called out for detectives for, let's say, some like crime that's like more like a theft or whatnot. Okay, I'll be there right now. I get excited. So it's way different. It's like, yeah, as a SWAT guy, you're like, I don't want to stop because this is what I love to do. I want to be able to go with the guys. It's like your boys, it's all good people. So it makes it even funner.
Yeah, it's the most team-oriented aspect in law enforcement that we have, and kind of going back to that tactical athlete piece. You rely on each other and you train together, and those call outs are game days, not to downplay it, but it's like game day. That's what you train for. That's what you do everything for is to go out and win. So that's kind of the mindset, and you don't want to let each other down.
When I hear that all
the so how guys heard now you
like the minute, let's say I do have a patient that their initial appointment, their injury is a little more serious. Let's say a lower extremity, for example. As a police officer, basic thing is being able to run. And I don't necessarily, do I care if you can run after the bad guy? Yes, but I care more that you can get your buddy out of a bad situation. I care more about your own safety. And if you can't even walk in here, for me to be able, like, I hear you, but they always say, like, I don't want to let my team down. I'm afraid to, like, tell work that, like, I can't work, or I don't want to let my beat partner down. I'm like, you'd probably be letting them down a lot more if you can't be their backup when they need you. So I hear that all the time out of patients is like, I don't want to let my team down. I don't want to let my beat down. I don't want to let whatever it is. And so it is just like working with athletes because they have the same mentality. But I don't think a lot of my patients view themselves as tactical athletes.
No, exactly. And I could kind of go off that too, just even on the regular like deputy side working, because when I first started working, we were understaffed a lot. And it was to the point where we had a sergeant and then had sometimes 2 or 3 deputies for the whole county. And our county is pretty big. And so it's like 1,400 square miles, pretty big. And it'll be cut it in half, and one deputy has the east side and one deputy has the west side. We're talking miles away. The guy could be 45 minutes an hour away, and your other partner's way over there. So now if one guy gets hurt, you're kind of screwed, And so it got to a point where it got a little better when more deputies came on. But a lot of times it could be like that, a sergeant and 3 deputies, a sergeant and 2 deputies, a sergeant, maybe 4 deputies. But like I said, if one person's done, you're pretty stuck. And I remember when I left, I had like 200 plus hours of like vacation time, and like I had like hundreds of sick time. And I remember my wife had said, like, why do you have so much time for us? Because you would never want to leave, because you feel bad that you're going to leave these guys. Now they're down a deputy, and it's really huge as it is to kind of handle the whole county on its own. So you don't, even if you could be sick, you could be feeling hurt, whatever. You're like, oh, I'm just going to go to work anyways, because no one really wanted to do that. And it was to the point where like you would I remember showing up to work one time and throwing up in the trash can before I walked into headquarters. They're like, just go home, bro. And it's like, are you sure? Like you felt bad. Like, you sure? Yeah, we got it. Don't worry. And it's like, all right. Then you go home. Like you had to show up to be like at your worst, then go home type of thing. because you want to make sure that you let them know, like, I'm here for you regardless. I don't care.
Yeah. I mean, I've done those very same things as well. I mean, I think that's the thing is cops all over the country, I'm sure firefighters do it, but just speaking from a police perspective, we do all those same behaviors just because you almost have to show up injured or sick to let everyone to validate, like, okay, you're good, go home, we understand, we see you, well, I'm here for you, now we see you, it's one of those types of mentalities, those exchanges.
No, it really is. Oh, I'm pretty sure guys will show up with casts that they could, too, they with broken bones. I could kind of go into that too with myself. An example is when I got into my shooting, the reason why I was even a cop in the first place, and my mentor and my good friend, when I got into my shooting, he showed up first and pretty much got in front of the guy was still kind of in the car. We don't really know his condition. My whole hand was bleeding. And so they sent me to the ambulance, and he's like, hey, go to the ambulance. Like, you're good. You got this. You shot. Like, just get out of here now. We got this. Like, I'm going to take over, whatever. So it was like my sergeant, him still had guns on the car. But my mindset was more thinking like tactical athlete, like, all right, let's go get bandaged up real quick. So I ran to the ambulance, and they're glass and blood and a deep cut. And they're like, I'm going to just wrap it. Like, there's so much glass. And I'm like, I don't care. Just wrap it. Like, I don't need whatever it is. Just wrap it. So they just like wrapped it, put gauze and wrapped it. And I was like, cool, thanks, bye. And then I took off and took my gun back out and went back out into where everything was at. And I remember showing up and tapped my partner's back, and he's like, Rios, what are you doing? Like, you can't be here. You just shot someone. Like, it's go. And I'm like, oh, okay. I was just thinking more like, I want to be here for you because no one else here, It's just like the whole cavalry's not here because, again, the county. And he's like, you're good. Just go. You're fine. But that was my mindset. It's more just I don't care about the help I need right now for my injury. Right now it's more about you guys. I'm going to be here for you guys regardless. So.
And I'm glad there are people that are wired that way to do that, and that's selfless. And I tell my patients that all the time too. Like, I'm glad you do what you do. I wouldn't want to necessarily do it every day. But I think the thing that I think about and hearing about these physical injuries, or like, you're physically ill, or like you're limping and you can see the wound, you see the gunshot wound, things like that, are just the challenge that is entailed with the injuries you can't see, like the trauma, or the all right, we're almost ready to go back, but maybe you didn't quite work through the mental aspect of your injury because it was traumatic in nature, or the intrusive thoughts that came along with that call, or what have you. You can't see those injuries, but they're still affecting how you process and interact with people, your sleep, you're not sleeping, all the things that go into like real recovery. That's an even bigger hurdle to overcome in the world you guys work in. That's why we have our mental health practice, so that people at least feel like they have a little more permission to say they're not okay because the resource exists, But there's a lot of that also goes into the athlete side of care. So there are professional athletic teams that I know, if you get a physical injury, you are also required to report to behavioral health, because they have to sort of not check a box in a bad way, like by going through the motions, but just make sure, like, hey, you got hurt. Are you good? Like, how do you feel about your injury? How do you feel about losing time? How do you feel about being off the field? Do you feel like do you want to adjunct to your physical wellness with mental wellness services? Yes or no? Like, they have to go through that step, even if they're fine, because that plays such a big role in it.
I love that. That is obviously why, too, I have the Fit podcast now, and then do the stuff I do on this side of things. It was because of mental health stuff, because that same guy, my friend, that same guy ended up killing himself later. And so when all that kind of unraveled and I went through my own mental health journey, kind of going through that, I was like, okay, I see how important this stuff is now. So doing what you guys do then on the mental health side of things, do you guys ever, because I'm a big believer of like stress turning into pain on the body physically. Do you guys ever go with that with your patients?
We see a lot of like chronic PTSD playing out in like physical aspects for sure, especially with our patients that have neck pain and low back pain. That's sort of non-traumatic, non-surgical. They just have had, or are folks that have had like multiple concussions too from car accidents or falling or things of that nature. So we definitely see psychosomatic pain play out in our chronic cases. What's great about the trend we're seeing now is our patients that are 35 or younger are far less apprehensive to say, like, I need help. Even appointment like 1 or 2, I had a patient in here yesterday kind of explaining, like, we're getting back into like the highly physical stuff. And I'm like, all right, I want to see what you would do in your own workout. And she's like, well, she just willingly told me, I want to deadlift. I just haven't deadlifted in a while because I'm afraid to. I'm like, well, so this is a knee injury. Explain to me why you're afraid to deadlift. I understand how the knees are involved in that movement, but like, that's more posterior chain, back, and glute. Well, the last time I deadlifted, I hurt my back. I was like, okay, well, how much were you lifting? She was like, not that much. I was like, well, what do you think contributed to getting hurt given like the low level of weight and everything? She's like, well, if I'm being really honest, I had a really bad run the day before. I was on scene all day. It was a very traumatic scene. I had to give some of the worst news to a family that I've ever given. And like, I just didn't sleep well that night. I went to the gym and worked out and I hurt my back. I was like, you honestly probably hurt your back because of just everything else going on too. Like you were warming up and hurt your back. Your body just like wasn't in the right state to maybe work out like that day. And like, she's just not revisited it since. And it's been like 6 months. And we deadlifted yesterday and we deadlifted double the weight that she hurt herself doing. And she's like, that felt so good to do, but I feel so weak at the same time. But I know now that like that event sort of like played out in a way that's your body's alarm signal to be like, stop. I don't feel good doing this. But it's sort of like the last alarm signal that people will listen to when it's like a mental health aspect of it too.
No, exactly. I'm a big believer that's especially been with the coaching and whatnot and everything like that. I've experienced it myself because I think a lot of what I was feeling as well with that pain that I had shared with you was mostly just from stress. And I guess I'll kind of it'll probably help someone. That whole 2 years of that, again, back to whole physical therapy and whatnot, like everything was feeling much better. I would say like 80%, 75, 80%. But we're kind of maintaining at that point. I went from going physical therapy twice a week, every week to once every 2 months. So we have obviously made some improvements in the workouts, so being better. But there was still something that was kind of like, would still cause a lot of flare-ups every day. And I realized I guess my marriage at the time wasn't really going so well. To me, it was going good, but I don't know. But my wife at the time ended up telling me like one day to the next, like she wasn't in love with me anymore. And it's been 2 years since when she fell in love with me. And then, so like I said, that was 2 years of that pain. And to her, it was like, I fell in love with you 2 years ago and type of stuff. And if it wasn't for a kid, she would have left a long time ago. So I was just thinking like, when I reflected back on that moment, it was more like, maybe that's why I was feeling some kind of underlying pain. Because it came out of nowhere. It wasn't like a car crash. I remember my sister was like, did you get into a car wreck? Did this happen? That happened? I'm like, no, I just woke up one day. And there is this like small pain, but now it's a much bigger pain. And so maybe reflect like, shit, maybe some underlying thing in the relationship was going on. My body was feeling it. She was feeling towards me. And over time, it just got worse. And obviously, we're at this point now. And the reason I can say it, I think it's from that, like a lot from stress, because the moment we separated, we did everything together, finalized everything, then got divorced. And like, once that was done and set, it was like pain just, and I started feeling better. I'm like, oh shit, like I've been holding on to something. And I guess it was more just emotional or affection type of stuff. But now that that's gone and this whole thing, like we're doing our thing, still co-parenting, like, but I feel so much better. So that 75-80 went to 90 very, very quick. A lot of first response, obviously, marriage is a big one. Relationships is a big one. So I feel like now that I've experienced that myself and I'm learning that stress could become a physical aspect on the body and manifest itself in that way, we should probably start looking more into that as well. So now I try to share that as much as well to kind of, because it does happen. Because it's hard to believe. Cause I didn't believe it. I was like, that's dumb. Because when my friends had told me, that could be that, I'm like, nah.
That's very true.
But definitely. Now, one thing I want to kind of go over, though, I know you talk about when someone shows up, you guys, everyone's kind of bullshitting. It's a good time. Everyone's comfortable. So my stepfather is a correctional officer. And when he met my mom, he looked great, muscular, fit. I was like, awesome guy, right? And now I always make fun of him because since he did my mom, they've been together for a while now, but like within the last like 2 years, I would say he gained like 30, 40 pounds. So quick, right? Like it's a very short amount of time. And then he always tells me like I have really bad back pain, I have really bad sciatica. We're just walking this past weekend and just walking would flare it up, off just like an easy, we're just doing 1 mile walk from one hotel to another. We were down in Laughlin or whatever, because I was in Arizona, and yeah, just a simple walk. I was like, I was walk that real quick, and then he was just like in huge pain, struggling, and I was like, Joe, because you're fat, like you gained. And then he wouldn't mind sharing this stuff because I always say it out loud to everyone. Like, it's just because I'm a very honest person. You know, I'm not here to cater to people and just like, maybe it's no, like, it's because you're fat. Like, you got so much weight. You're not, he's not 6 foot. It's probably like 5'7", 5'8". So average height, right? But it's just like you put so much weight in so little time and you still do the job. And then, but it's just all this sitting right there on your back. It's just because you're fat. You don't work out. Like, you stop working out. You worked out when you met my mom, but then for some reason, after a short time went by, you stop working out. You don't do any kind of cardio anymore, and you just gain all this weight and just eat. It's as simple to me. It seems very simple, but I guess my question to you guys, like, his case is very normal to me from what I saw when I was working. And so when guys come to you and it's not so much like an injury, and it's mainly just like, all right, tell me about your day. Well, I don't really work out. I don't really have good nutrition. I gained a lot of weight in the past 3 years. And again, I work with a lot of first responders as a nutrition coach. So it's like, I see the same story as my stepfather with majority of people. Are you guys as honest in that moment too, to be like, it's because your weight problem? Not, I guess not as, like, no, not as mean, but like, some people need to hear it, like they just think of something else.
You're not wrong. And I don't want Brice to take offense to this, but we see this a lot when people come inside from this and like get off the street and get behind a desk, or like they're really fit in the academy and they get like their freshman 15 because they aren't, keeping up with their fitness and they're in the car now. Like there have been people that walk in and my partner and I are like, holy crap, is that so-and-so? Like did they come inside? Like what happened? We gotta tell sometimes. But I do have really honest, you have to. You're not really doing yourself, you're not really doing your patient you're doing them a disservice if you think as the musculoskeletal expert, you're going to cure their back pain, you're lying to yourself and your patient, because I am not a cure-all, I'm not a miracle worker. The habits that you need to form, like I could see you every day. I could go back to my traditional setting. I used to see my athletes every day, multiple times a day for treatment. Now I'm seeing my patients once, twice, maybe 3 times a day for an hour. I am not too proud to say that appointment for that hour is not going to change your life. What is going to change your life is getting better sleep, fueling your body better, and making better choices. It really isn't that hard, but changing people's habits is extremely hard. And so that is definitely a conversation I have with people, and I just educate them, like 1 pound of body fat loss is 5 pounds of pressure on the joints. Imagine if you lost 10 pounds. Then the whole conversation now is like, should I try Ozempic? Should I try?
I'm getting you started on that one.
No, because there's no quick fix. This is like a lifelong change. Do you meal prep? I'm not a nutritionist. I don't pretend to be one. I'm kind of like a self-proclaimed just nutrition interest person, but like just it's easy. It's not rocket science. People way overcomplicate it with diet and restrictions and trying this and trying that. It's more about the long-term effects of the choices you make now. And I do have those conversations with my patients, and I cover the whole spectrum of things and try to impart as much wisdom as I can on them. But, when I see my patients that have had knee surgery and still have knee pain, but they're probably like 50, 60 pounds overweight, like, your knee is not the problem.
Exactly.
I have. And I've had those conversations where my patients were like, are you calling me fat? And I'm like, I didn't say that. I'm just saying that
Yeah.
maybe we can make better choices.
It really is, though. Like, one of my clients right now, he's down like, I think like 120, 140 pounds. And let's see, he was like 420 when he started. He's like 260 now, 270. Oh shit, it's probably way more than that then. But one thing that he does shares me a lot, because he shares a lot with me when he checks in, is how good he feels like body wise. People don't understand. Let's say they're 50 pounds overweight, not compared to his level was more extreme, but like that does help. Obviously, it's a mission. It's another mission to kind of go with it. That's why I focus most of my attention now onto first responders rather than what I was doing before the last few years with coaching, because I was like, you know what, I just really want to help these guys, because someone like my stepfather who's in that situation, and that's exactly what I saw all the time. And it's just I really truly cared, because not only can we be our best, like when you talked about your stuff with ProTeam Tactical, like that's awesome, but then we need the other like tripod of the other leg of the tripod, which is going to be more on, are we doing anything with, are we with our weight, with our nutrition? Because with our workouts, like you said, movement is medicine. And so when you just stop all that, and I feel like they focus so much on the academy, because I had another friend I went to the academy with, he gained 60 pounds the first year as a cop, or no, 100 pounds. Like his stomach, he shared me, his stomach was touching his steering wheel in his patrol car. And he couldn't breathe and was on that machine. I can't remember what it's called. What's that machine called?
Oh, it's
CPAP.
CPAP.
Sleep app, yeah. And so when he worked with me, we dropped like 60 pounds going through my process, which is a very sustainable approach. And now he's off the CPAP, and now he looks great. And it's been like 3 years since he left, and he's still maintaining exactly where he was. Like, that's my mission. And so it's like, it just sucks that we had to get to that extreme. I guess like for me too, right? For my physical pain stuff. Like, so I guess I can't really talk because I waited 2 years dealing with my stuff. But I guess it's the same with them. Like, that they get to this extreme where it's going to get really bad. Like not fitting in the patrol car and be like, damn, now I need to figure this out. And it sucks. So, because like, I wish we could have everything, not just ProTeam Tactical on site, but just like nutritionists on site and personal trainers on site to just make sure our guys and girls are like set, just like special forces are in that sense. But
yeah, I wish we could be everywhere and provide all those services. And also, though, some of the onus has to go back on the first responder too, or the client, or whoever you're working with. Because like, we can want it as bad as we want it. That's sometimes the hard part for me in my position, because sometimes I want it more than them, but I can't make them do it. Like, I can lead a horse to water, I can give the horse a straw, I can force its face down into the water, but like, you got to do your part too. And sometimes it does have to get really bad for them to like have a wake up call. So I think just opportunities like this, to be on a platform like this, and to talk to you guys and have the ability to learn. I'm like, every time I talk to first responders, I learn something, or I try to learn something, but being able to like kind of put my, as close as I can, like first responder hat on, is just one way to kind of just like get it out there for everybody and talk about these things, so that people, one, know the resources are available. They know that people care about them, and it's okay to say I need help.
Mm-hmm. Brice, with you being a law enforcement officer and working with ProTeam Tactical with Beth, do you feel like there should be any kind of physical fitness standard for law enforcement officers?
I do. Not only that, I think there should be some level of mental checks, just a mental and emotional checks. I mean, I know that scares a lot of first responders, especially police officers, because of the things we see and do or exposed to, and just our general overall mental makeup. But we go to the doctor to get a heart scan every year, right? Or we get our cholesterol levels checked. If we're not, we should be, with our cardiovascular rates as bad as they are, right? So why not have a mental checkup? So, but yes, I think there should be physical and mental standards. But I also think too, we as agencies need to allow a space for our first responders to maintain those levels of mental and physical health, whether that's through an on-site gym inside the police department, or paying for a membership, or allowing time to go work out. Like, those initiatives, if we're going to require folks to maintain a fitness level, we should give them the space to do so.
I love that. Cause I know every agency is different. That's the bad part. But I know some departments that I work with some guys where their department pays for them to go to their on-site gym. So they're getting paid while they're there.
Yeah.
Whether it's before work or after work. I didn't do that, but I really do love that. I know about the one who would pay the gym membership in the town that they worked at, so they could have a free gym membership.
Yeah.
But then it goes back to what Beth's saying, like, it's still up to them to go and do it.
Right.
And you get guys like me who would be like, I'm all for that, shoot, free gym membership. But then you got the other ones who are like, well, cool, that's a good incentive, but I'm still not going to do it, which kind of sucks. But I really do like that though, Brice, because that's something I was actually talking about recently with my wife right now, is because she's a nurse and she's a travel nurse, and I asked her about, what's the best hospital you've been at? She's like, there was a hospital in California, I can't remember what it's called, but she was up north, and she was like, they had these stations for nurses where they could like take a nap at and rest, and then while on site they had like a kind of like a masseuse, like a short-term masseuse, like for 15 minutes, 10 minutes, 15 minutes, and they'll do like the upper back or the feet or whatever on site, doing that nonstop. And then the little room had like healthy snacks and water and stuff like that. She's like, it was amazing. Like you just felt good. Like, you be working, do that real quick, and then go right back out to work and be good. But then she's at other hospitals in the nation, it's just completely opposite, like they're just being the way the schedule is, like working 1 day, off 1 day, working 3 days, off 2 days. It's like really unknown type of stuff. So I say it's going to be the same thing with law enforcement. She had asked me too, like, how do you feel it would be beneficial for, in that case, like in that example, for like first responders or law enforcement guys, like how you think admin could have help? And I was like, honestly, it would just be a money issue though. And I don't know how, I never been admin, and I don't know how, and I guess everyone would be different, but it's going to cost a lot of money. And we're dealing with the situation of people wanting not to give much money to law enforcement in the first place. So it's like, how do we, allocate those things to different areas that need to be done? But then now we have to focus on the first responders and how we're going to allocate that to them. And then she was talking about, well, we could raise the money, fund the money. And I'm like, babe, most people don't even like the cops in the first place. Why would they give the money to us? So yeah, but there's some departments who live in good cities and like they're all about, pro cop. But then there's some departments that are in cities and they don't even want them there in the first place. So how is that department going to get the money to be at their best, compared to the other one? And that's just the copy part.
Especially with like recruitment and retention and fringe benefits and pay, like now you're competing with just getting people in the door and on the department, let alone what other, icing on the cake, so to speak, we can add to it. But yeah, it's definitely a challenge. And I think there's a space for it.
No, it really is. I really think so too. So before we go though, as far as like resources for what you guys do, ProTeam Tactical, or anything as far as like the mental health side, the physical side, is there anything that the listeners could go to kind of find where they could kind of get some help from?
Good question. From a physical aspect, I'm actually working on a presentation I'm giving at the end of April/early May at a SWAT Officer Association meeting where I'm putting together some resources because I know everyone doesn't have access to us. As badly as I want that to not be true, like, okay, you told me all these cool things, but like, now what do I do because I don't have a pro team? Right? So
yeah, it's true.
Yeah, it's like, cool. Now what?
Thank you for the podcast, but
Yeah, exactly. Thanks. I'm gonna keep doing what I've always done because I don't have a pro team. But I do think that it's worth, at least as the officer, something like hearing something like this. I would want to talk to my leadership if I could and be like, hey, I know we don't have these resources, but like, what other benefits do we have when it comes to wellness? And I know sometimes they'll get the answer of like, well, you can talk to our like wellness coordinator if you have one, or, we have these amazing nutrition things and like, we offer this every quarter, what have you. But when it comes to like physical aspects of your wellness, there are actually some really good applications that my officers have taught me about, just like fitness apps that are really simple. Find yourself a Rios and start getting trained, basically, wherever you are. I mean, invest in yourself. A lot of times, personal trainer people, have programs that they design that are 6 weeks, 8 weeks, 10 weeks, 12 weeks, whatever, because it's a part of your wellness. Use your HSA money that you already allocate to healthcare benefits to be able to pay for it. I mean, I know a lot of my patients that spend money on stupider shit than like their wellness, like a brand new souped up loud truck. Like maybe go spend that money.
No, I didn't know trucks were that expensive, but I had a friend buy $100,000 truck. I'm like,
dude, I don't understand it. Like that, the first big kid check that a lot of our recruits get, like all of them have new cars in the parking lot the next day. But anyway, I digress. I say invest in wellness, find a good personal trainer, do 12 weeks of a program. I'll be perfectly honest, the first 6 to 8 weeks are going to suck. But then once you have that habit, it's just like part of your everyday. Find an accountability buddy who will go roll with you, who will go to the gym with you, who is in the same kind of spot as you are. Because maybe you're a little gun shy to go to the gym because like you just don't know what you're doing in there, but invest in yourself. Ask within your agency, like, hey, I know you work out a lot. I just don't know, like, do you train with somebody? Do you train by yourself? Like, get around other people that have these good habits if you don't have immediate resources to like the fitness aspect of it. On the injury side, starts with a conversation, I think, because I don't know how other other agencies work, right? But like if you get hurt, you probably have to go to occupational health clinic. They don't really know what you do. So then you feel like it's a waste of time and you're not going to go back. So you're actually not going to get better. Find me on Instagram. I'm happy to consult via direct message and just see what I can do for you. But it's unfortunate that you don't have these like injury resources, or you go to the emergency room and they don't really do anything for you there either. So
It's a waste of time.
be the change agent. Start having the conversation about like, hey, we need to improve our work-related injury resources. And same thing on the wellness side of it. A lot of times it just starts with a conversation.
Exactly. I love how you said the whole HSA thing, because I didn't know that was a thing, but one of my officers that joined coaching paid with his HSA. And I was like, oh shit, I didn't even think about, because when I explained to guys, I didn't even think about, hey, just use this. And I was like, oh, that's pretty awesome. That's freaking cool.
Yeah, like right on my HSA app, because I have it, it's like, what is your expense going towards? And one of the things is like a fitness class or like fitness coaching or nutrition or whatever. Like a lot of people think like you have to use it for copays or like surgical things. Like, no, if it's health and wellness related, you can buy shit on Amazon with your HSA.
Yep. See, I never do that. It's so cool. I love that when he did that. I was like, oh shoot, everyone should be just doing this then.
Yeah, exactly.
So it's the end of April, beginning of May. Do you mind? Can I join that or share, or is it, or it's live, right? You said the seminar's live.
It's live. It's in person in Indianapolis. It's the Indiana SWAT Association conference that like people from all over the country come. I'm happy to share the link with you so you could like share it to your followers and just shout it out.
Yeah,
so people can register and stuff like that. But I mean, I think this year they have like 400 people registered to come.
Nice. Is it going to be recorded at all?
I don't know. That's a good question. I can definitely ask the meeting coordinators.
That would be awesome if it was, for sure.
Yeah, it's all about mental, like resilience training for the tactical professional.
Awesome. Yeah, please share that with me. I would love to have that. Is there anything that you two that didn't ask that you would love to share before we get going?
Do you have anything, Brice?
I just say thanks for the opportunity, man. This is great. I appreciate the work you do and fully support it.
Thank you. I appreciate that. Do you guys have any Instagrams you want to share? ProTeam Tactical, Beth, Brice, any of you guys?
Yeah, definitely. So ProTeam Tactical has an Instagram handle. It's just ProTeam Tactical Performance. Another one that you could follow is ProTeam Tactical Foundation, because we have a nonprofit as part of one of our arms in our advocacy. ProTeam Wellness also has their own Instagram. All of them are just the names of the handles. And you can also follow me, EJ. I don't even know my Instagram handle now that I think about it. Let me look that up.
So much using the other one.
Hold on.
EJ.
I run the
EJ1021.
Oh, EJ1021. That's me. Follow all of them.
Sounds good. And yeah, send those over to me too, and I put them on put them as links at the podcast.
Awesome.
But I appreciate you guys
for the opportunity. Yes, thank you for letting us have this platform and talking about something we're both very passionate about. Thank you for all the work that you do as a first responder, former military. Thank you for your service. I'm grateful for the selflessness you both display on a daily basis.
No, I appreciate it. I appreciate you guys, everything you guys do, because when I first heard this, I was just like, this is freaking awesome. Because like you said, like the people come in as like, this is not true. And it really is something that you're thinking. Like I always say, like, train like a professional athlete, we don't get paid like one. And you're literally giving this service to that community, and it's freaking awesome. So I love it and I appreciate that. And I'm so happy that you guys are doing it. Brice, I'm so happy that you're going from this and going to and that. Like, that is freaking awesome. That's so cool. And I hope it goes around the whole nation and this covers the whole United States. So
us too.
Thank you again.